Hi, I'm Sogra Fatima, a physiotherapist working with BR Medical Swiss, and we are going to deal with the joint mobilization in the frozen shoulder condition. Frozen shoulder is an inflammation of your capsule. It is also known as adhesive capsulitis. Before going to the frozen shoulder directly, we'll just see the anatomy of the shoulder joint. Shoulder joint is a ball and socket type of joint, which is formed by the articulation of the glenoid fossa and the head of the humerus. This is the most mobile joint of the human body, and it comprises of the 6 movements, that is flexion, extension, abduction, adduction, and the internal and the external rotation. Frozen shoulder occurs when the shoulder range movements are not normal, as like in cases of injury like tendinitis or any injury to the shoulder, or in the post-surgical cases, and mostly in the diabetic patient. And it is more common in the women than the men, especially the women after menopausal. And it restricts the limited movement, and it gives you pain, it will give you stiffness, and it mostly affects the activities of the daily living. If a person diagnosed with a frozen shoulder, he has 2 options, either to go for the conservative treatment or else for the non-conservative treatment. In conservative treatment, we have medication, we have hydrocortisone injection and a physiotherapy, whereas in non-conservative treatment, we have a surgery. Physiotherapy treatment in case of frozen shoulder constitute of 2 things. First, the pain management, which is done by the pain modalities like ultrasound and TENS. When the pain is under control, we can go for the mobilization of the joint, which helps us in increasing the range of motion. Because in frozen shoulder, the main aim is to get the range back. Because of that, the patient suffer with their own ADL activities. Mobilization is a passive, skilled manual therapy technique applied to the joint and the related tissues, as it has glides or some movements of the shoulder joint which help in the increasing the ranges, as we have posterior glide which help in increasing the flexion and the internal rotation. Anterior glide help in increasing the extension and the external rotation. And we have one more, that is the inferior glide will help in increasing the abduction, that is sideways movement, and the distraction which help in managing pain and the general mobility. The joint mobilization is the much effective and the best selected treatment in the condition like frozen shoulder. When the patient is treated with the joint mobilization along with the pain modalities, pain relieving modalities, they shows a good improvement in the pain management and as well as in the mobility, and they can be back to their daily living activities within 12 weeks.